Good evening, students. I hope I'm audible. So, today, what we will be doing is we will be. Good evening, everyone. I welcome you to the oral and maxillofacial surgery image based session. So, I hope I'm audible. So, what we will be doing today is we will be doing an image based session. Okay. And in this, so this is part 1. We will be starting from the basics. Okay. In today's session, I've included majorly the instruments and the armamentarium. Okay, I've included the instruments and the armamentarium. In subsequent sessions, we will be covering further image-based topics, and in subsequent sessions, we will also be covering image-based questions. All right. So, in today's session, I have just included basic instruments and armamentarium in basic oral surgery. In the next session, we will take up trauma instruments and trauma-based images, and so on and so forth. We will be further advancing into our curriculum. Okay, so if there is any doubt or if there is any question that you want to ask me, you can write down in the comments below. I will be replying to every question or every doubt that is posted in the comments. So let's start with our first instrument. I will also zoom out the picture for you all to see. So this question says identify the instrument. Now before looking at the answer or looking at what is the instrument name, just have a look at the instrument here. Just have a look at the instrument here. So if you see, this is a hook kind of an instrument. This is a hook kind of an instrument. This sharp hook over here. If you follow my pen, this is a sharp hook kind of an instrument. So this is skin hook. This is skin hook. All right, this is skin hook. So what is it? It retracts skin. It retracts skin in an atraumatic manner. In an atraumatic manner. I'm going to zoom out again. A long slender instrument with a sharp hook at its end. Long slender instrument with a sharp hook at its end is skin hook. Alright, it is skin hook. Now coming on to the next image, it says identify the number 15 scalpel blade. Identify the number 15 scalpel blade. Now this picture shows you 4 options. It shows you 4 options. One by one I'll tell you. So all of these blades at some point of the other can be used by us. So we need to be thorough with what is being shown over here, or we need to be thorough while identifying. So if you look carefully, the picture A is a broader blade. It's a broader blade. Picture B is a narrow, sharp, tapering blade. Alright. Picture C is a sickle shaped blade. Again, it has a curve. Picture D has a narrow working end and it has a broad back end. Alright. So your picture A is blade number 10. Picture B is blade number 11. Picture C is blade number 12. And picture D is blade number 15. Okay, I'll repeat. Picture A is blade number 10. Picture B is blade number 11. Picture C is blade number 12. And picture D is blade number 15. So the answer to this question would be option D. Answer would be option D. Now I have, along with the blade, I have in this table enlisted its uses. So blade number 10 is used for extraoral skin incisions. It is used for extraoral skin incision. Blade 11 is used for stab incision for incision and drainage. Blade 12 is used for clavicular incision. Blade 15 is used for intraoral mucosal incision. Blade 15 is used for intraoral mucosal incision. Alright, I hope that is clear. Okay. Now, coming to the next instrument. If you look carefully, we all have used this instrument. I'm zooming out the maximum so that you can appreciate. If we see carefully, we all have used, this is a very common instrument. We all have used it. We all are aware of this instrument. So this is a periosteal elevator. This is a periosteal elevator. If you look carefully, one end is flat, spoon shaped. One end is sharp, conical. Alright, one end is flat, spoon shaped, one end is sharp, conical. So this is your periosteal elevator. This is your periosteal elevator, and if you want to know the name of it, it is Molt's number 9 Molt periosteal elevator. Number 9 Molt periosteal elevator. This is the name. Alright, number 9 Molt periosteal elevator. And what is it used for? We all know it is used for elevating the mucoperiosteum while doing our extractions. It is used for retracting and elevating the mucoperiosteum while doing our extractions. Okay? Alright, everyone, is that clear? Molt's number 9. Sometimes they ask you the name also. So you have to know Molt's number 9 periosteal elevator. Okay? Now I'm zooming out these two images. This also you have to identify the instrument. Now just look at these two instruments. This instrument is a right angled instrument. It is a right angled instrument. Okay, it is a right angled instrument, but there are two variations to this instrument. If I zoom out the first image, you can see that it has two prongs like this. Okay, it has two prongs like this. The second variation, the instrument is exactly the same as the previous one. It is exactly the same, but there is a, this end is completely curved. This end is completely curved. Okay, so this is nothing but your Austin's retractor. This is nothing but your Austin's retractor. Okay, this is your Austin's retractor. Alright, now it is used to retract soft tissue or cheek. Please be thorough with the name and the spelling. Austin's retractor, and it is used to retract soft tissue and cheek. Used to retract soft tissue and cheek. Fine. Our next instrument. Our next instrument. If you see, this instrument has a broad end. One end is broad and it has 3 holes. It has 3 holes. Okay, and one end is a little C-shaped, or it is a little curved. Okay, this is your Veers tongue depressor or Veers retractor. Veers tongue depressor or Veers retractor. So Veers tongue depressor, as the name suggests, it is used to retract the tongue. It is used to retract the tongue. This is Veers retractor. It is used to retract the tongue. Holes present in the retractor help in engaging the tongue. I'll show you a clinical picture also. Just see. Probably a third molar procedure is going on. So the Veers retractor is keeping the tongue away from the field and the holes have engaged the tongue. they have engaged the tongue. Okay, Veers tongue depressor or Veers retractor, it is used to engage the tongue or retract the tongue. Alright, this is the clinical application picture. Now it says identify the instrument. I'm zooming out. So this is an instrument which we might not have seen very commonly in our clinics. But I just want you to remember the shape. Just remember the shape. It is not exactly S shaped, but it is kind of S shaped, we can say. It is kind of S shaped. This is your Minnesota retractor. This is your Minnesota retractor. Okay. Minnesota retractor, used for retraction of cheeks and flaps. Used for retraction of cheeks and flaps. Alright, Minnesota retractor. Have a look again. Anyways, this recording will be available, so you can always come back and revise and recheck. Okay, Minnesota retractor. Now, this question also says identify the instrument. Identify the instrument. So if you look at it in sideways, you might not be able to completely judge what the instrument is. But have a look here. So it has zigzag the ends are in a zigzag pattern. If you follow my pen, the ends are in a zigzag pattern. Okay, this is your Ellis forceps. This is your Ellis forceps. Alright, so it is used to hold and retract the soft tissue, and this is a traumatic instrument as it has a sharp beak. Ellis forceps, it is used to hold and retract the soft tissues, and this is a traumatic instrument as it has sharp beak. So what you do is, if you want to hold, say, a muscle or a tissue, you just take the Ellis forceps, clamp it on the muscle or the tissue, and just pull it, so it will help in retracting the soft tissue. It will help in retracting the soft tissue. Now identify the instrument. Again, all of us are very thorough with this instrument. We use it regularly in our clinics. If you see, there are two flat ends of this instrument. One bigger, one smaller, and it has parallel serrations like this. It has parallel serrations, and on this end, on this particular end, on the back side, it will have serrations. It will have parallel serrations like this. So this is nothing but your bone file. This is nothing but your bone file. Again, we are all very familiar with this instrument while doing alveoloplasty. After extraction, if there are some sharp bony ledges remaining, bony spicules that are there, you just take this bone file and you file away the sharp end of the bone. Alright. So this is a bone file. The use is to round off irregular bony margins for final finishing or contouring. For final finishing or contouring. To round off irregular bony margins for final finishing or contouring. Now this is something new and interesting. It says identify the setup. So I'm going to zoom out. Okay. If you see here, I will explain each and every component of this setup. If you see here, you have a machine kind of a thing, which has displays and it has certain buttons. Okay. Then if you identify, on one side there is a stand in which there is a fluid connected. Okay, in which there is a fluid connected, and the fluid is attached to this unit. The fluid is attached to this unit, and the fluid is then attached to the handpiece also. There's one attachment to the handpiece. And the handpiece is also attached to the main unit. This is your handpiece. This one is your handpiece. Main unit. Okay. And there is a foot control. There is a foot control which is attached to the main unit. Foot control which is attached to the main. This is nothing but your Piezosurgery unit. This is nothing but your Piezosurgery unit. So please remember, a Piezosurgery unit will have a few components. There will be the main unit, which will have a display, which will have buttons, and that main unit will have few attachments. One will be your saline or fluid attachment, which will come and attach to the handpiece. The handpiece will be connected to the fluid, and the handpiece will also be connected to the main unit. Okay. There will be another attachment to the main unit, that is your foot control, from where you can operate the Piezosurgery unit. So these all components together make up your Piezosurgery unit. They make up your Piezosurgery unit. Alright. So this is a Piezosurgery unit. Now what does a Piezosurgery unit do? It differentially cuts bony and hard tissues. It is used near vital structures like major blood vessels or sinus membrane and helps in preserving them. Okay, so this will only cut your hard structures and not your soft tissues. So you can easily use this unit without any fear of damaging major blood vessels or sinus membranes or any other vital structure which you want to preserve. Okay. Now one more thing before we go on to the next question. This handpiece, if you see this yellow thing, this is your piezo tip or piezo insert. So the next question is talking about piezo tips and piezo inserts. Okay. So it says identify the instrument. If you see here, this is actually a piezo insert or a piezo tip. Okay. So if you just see here carefully, this one, this tip is flat. Here. It is disc shaped. Just have a look over here. This is flat. It is disc shaped. So this is your elephant foot. This is a piezo tip or piezo insert. This is a sinus lift instrument, and this is a elephant foot. And tip of the instrument is non-cutting. So maybe in the next session or subsequent sessions, I will show you a visual of a sinus lift procedure, and then you will understand how is this piezo tip used. Alright, you will understand that better in the next session or maybe in the subsequent sessions. Okay. Now this next question also says identify the instrument. Okay, so I have zoomed out. If you carefully look, this is a long instrument. This is the lock. Okay, this is the lock. And if you see, there are two pads here. Okay, so the inner surface of these pads have serrations. Like this surface has serrations. On the other side, this pad will have serrations. Okay, so this is a mouth gag. What is the name for this? Ferguson's mouth gag. This is Ferguson mouth gag. Now, This is used for mouth opening. This is used for mouth opening. So these pad where you see the serrations, they rest on your teeth, mostly molar teeth. These serrations rest on molar teeth. Alright? And then you can open. Once you get these two handles together, you get them nearer, these two handles, get them nearer, this, the anterior part of the instrument keeps on going in opposite directions. Once you get the handles together, this area opens up. Alright, so it helps in mouth opening. This is your Ferguson's mouth gag. Ferguson-Coupland mouth gag, also known as Ferguson mouth gag. Okay, please be thorough with the name. Sometimes they'll just ask, they might just in the options give you Ferguson mouth gag, or they might just give, or they may change it to Ferguson-Coupland mouth gag. Both are one and the same thing. Do not get confused. So it is used to keep mouth open during oral surgical procedures, and it is also used for mouth opening exercises. So these are the two main uses of this instrument. It helps in keeping the mouth open during surgical procedures, and it helps in mouth opening exercises. So what do we do is, this instrument, how it is used for mouth opening exercises, like suppose if we have a ankylosis patient post surgery, or we have a oral submucous fibrosis patient in whom we have to do mouth opening exercises on the chair. So what do is, we take two of these instruments. One we apply it on the left side, one we apply it on the right side, and we simultaneously open the mouth gag, so it will cause mouth opening of the patient. Then you keep it there for a few seconds, you close the instrument, you again reapply it both the sides, and you open the instrument and you do mouth opening exercises. This is how this instrument helps in mouth opening exercises. So next instrument, something similar, but the shape is completely different. So again, you have two pad-like structures. But this instrument is curved. The previous instrument was long and slender. Please notice the difference. We do not have to confuse. This instrument is curved, and this instrument has a scissor kind of shape, and there is a lock. Okay, so this is your Doyen's mouth gag. Alright, this is your Doyen's mouth gag. The complete name is Doyen-Jansen adult mouth gag, which may also be known as mold mouth gag. The function is the same for mouth opening during surgical procedures, for exercises, but the name is different, and we need to know the complete name, because sometimes you can just be given Doyen mouth gag or Doyen-Jansen mouth gag or mold mouth gag in your exams. All three names mean one and the same thing, so please do not confuse. Try to remember all these three names. Okay, just have a look again. Now coming on to the next question. Again, if you see here, these are piezo tips and piezo inserts. But if you carefully see, they have sharp beaks, and here also all around this instrument there are sharp beaks like this. Okay, so these both piezo tips, the ends are cutting. You remember in elephant foot the end was non-cutting. There in this, both the piezo inserts or piezo tips that I've shown you, the ends are cutting. Okay, and the ones that have those cutting ends are mostly used for osteotomy procedures, that is to cut the bone. osteotomy procedure, that is to cut the bone. Elephant foot had a non-cutting end, alright. It was used for sinus lift. Okay, but these both piezo tips or inserts are used for osteotomy and they have cutting ends. They have cutting ends. Now coming on to the next image. Just have a look at this. Just have a look at this here. I'm sure again we are all very familiar with this instrument. We have used it in our clinics many number of times. So this is a bone rounder. Now if you see, the ratchet or the lock of this instrument is slightly different. It is towards the inner side. It is towards the inner side. Okay, this is towards the inner side. And if you see, this portion has been zoomed out here. So the end, this rim, just follow my pen please. This is the cutting edge. And inside, if you see, this area is hollow. This area is curved and this area is hollow. This one is the cutting edge. The rim of it is the cutting edge. So this is your bone rounder. Now there is a name for this. Let's see. So this was a question asked in NEET last year. This was the question that was asked. The instrument shown in the figure below is used to cut the bone. So I've changed the question a little bit. There they had asked the name of the instrument. I have changed the question a little bit. The instrument shown in the figure below is used to cut the bone, remove bony spicules, to remove maxillary anterior root tips, or to cut the intermaxillary fixation wire. So option C is incorrect. Option D is incorrect. Now the question comes between option A and option B. Is it used to cut the bone? No, it is not used to cut the bone. This instrument is not used for osteotomy. To cut the bone means to do an osteotomy. And osteotomy is to completely cut the bone. Okay, so this instrument is not used to cut the bone. It is only used to remove sharp bone ledges or sharp bony spicules. Alright, it is only used to remove sharp bone ledges or sharp bony spicules. So it is used to remove bony spicules. Alright, please don't confuse. This instrument is not used to cut the bone. It is only used to remove sharp bony ledges or sharp bony spicules. That is it. Alright, so instrument shown is here in the picture is a bone rounder and the name is Blumenthal rounders. Blumenthal rounder, very important. This was one of the options given in the NEET last year. This was a question asked. This was the option that was given. It was asked to identify the instrument and one of the options was this. Which was the correct answer. Okay. Now we will do some extraction instruments. So today, like I told you, it is going to be a basic instruments class, and most of the instruments here that I'm showing you will be familiar with from your clinical point of view, and the ones that you have not seen, I am explaining that in detail. I'm zooming out. If you see this instrument, again, many of us would have seen this in our clinics, in our colleges. The very smooth curve end, long one with this central hollow. Alright, with this central hollow. Long instrument, round handles, long instrument, smooth curve at the end with a hollow. Alright, so this is your Coupland elevator. Just see the line diagram. I have another image. Just see this line diagram. Alright, some places it might be flat, maybe curved. Okay, this is the curved version. This is your Coupland elevator. Coupland elevator. Okay, this is your Coupland elevator. All right. Now coming on to the next image. I do not know how clear this is, but again, round handles, round handles. All right, and here the shank is at an angle, to the beaks. Okay, then again beaks are pointed. They are now pointed, sharp pointed beaks with a hollow. Sharp pointed beaks with a hollow. This is your Apexo elevator. Apexo elevator. Okay, this is your Apexo elevator. All right, is that fine? Now there's an instrument given in the picture below which may be described as. So this is a thin instrument again, round handles, shank is at an angulation to the blade. Okay, and this instrument, if you see this aspect of it, just has a gradual curve, and it is flat. It is a flat instrument. The blade of it is flat. Okay, so this is a periotome. This is a periotome. Now just see the clinical use of it. So this is also being used to, break the pedial fibers. Okay, break the pedial fibers. You see here, the periotome is placed between the tooth and the marginal gingiva in the sulcus. So this, what is this going to do? This is going to break the pedial fibers. This is a periotome. Periotome. Okay. This is another instrument. Just please have a look. One end is flat. One end is broad and flat, but with a slight bend, very slight bend, and this bent end is sharp. This is sharp. Okay, I'll show you the line diagram to understand it better. This is how the other end is, which I just showed you. This is how the other end is. Okay, so this is your Howard's periosteal elevator. Howard's periosteal elevator. Howard's periosteal elevator, it is used for elevation of mucoperiosteum. It is used for elevation of mucoperiosteum. Okay. Now, identify the instrument. Now, this particular instrument that I'm talking about can come in two variations. So, there are certain instruments, the name of which are the same, but there can be variations. The name is similar, but they can have two variations. So again, this is an instrument which has two variations. If you just see, there are two beaks which are approximating like this. Two beaks approximating like this. This region. Two beaks just approximating like this. Sharp, rounded, curved, hooked beaks approximating like this. Similarly here, two beaks approximating like this. So if you compress this, these beaks will go apart. All right. And this variation comes with a ratchet or a lock. Okay, so this is nothing but your towel clip. This is your towel clip. Okay, this is your towel clip. Please remember, I am now taking both the variations in one single frame. This is how both the towel clips, the name is similar, the function is similar, just that they have a variation to it. Towel clips. So what is the towel clip used for? It is used to keep patient drapes in place. It is used to keep patient's drapes in place. Now just have a look here, and then I'm going to zoom out. Again, a very commonly used instrument in our clinics. I'm sure all of us would be familiar with this. So if you see, again, this instrument has two serrations, not on the external but on the internal surface where the serrations are present. So if you, the inner surface of one of this would look like this, cross serrated with a groove. So this is the groove. This is the groove. Okay, cross serrations with groove, and one would just have serrations. There would be no groove. So don't confuse, this is all one and the same thing. This is a needle holder. Needle holder. Needle holder, and this is used to hold your suturing needle. This is used to hold your suturing needle. Alright, this is a needle holder. Okay. Now coming on to the next instrument. I am zooming out so that you all can see better. So if you see, this instrument has a broad end and it is curving like this. It has a broad end and it is curving like this, and this portion is hollow. Alright, I'm shading it in a different color. This portion is hollow. Okay, this portion is hollow. This is Babcock. This is Babcock. So this is Babcock's tissue holding forceps. Babcock's tissue holding forceps, and it is a non-traumatic instrument to hold tissues. Again, the function of this is same as Ellie's. You just grasp the soft tissue with this and retract it. Alright, it is used to, but this is non-traumatic because the ends are completely flat, smooth, broad. They're not sharp, they're not traumatic. This is a non-traumatic instrument. Alright. Now this question says identify the instrument and determine its site. First we will see the instrument. Okay, so if you see, this is the forceps, one end is plain and one end has a beak. Okay, one end is plain and one end has a beak. Now some of our extraction forceps are paired because they are different for different sides of the patient. They are paired and they're different for different sides of the patient. Alright, now we all know that maxillary molars have a bifurcation on the buccal aspect because there's a mesobuccal root and there's a distobuccal root. So this beak exactly goes and sits between the mesobuccal root and the distobuccal root. Now how do you identify? So what you're supposed to do is just imagine that you are the operator and you have a patient in front of you. Just imagine that you're the operator and you have a patient in front of you. Just hold that instrument. Just hold that instrument and let the beaks point towards the patient. let the instrument point towards the patient. So if this beak falls on the left side of the patient, so this is a left maxillary molar forceps. And if you're holding this instrument and this beak, suppose, falls on the right side, this beak falls on the right side. You're holding this instrument in your hand and you have a patient in front of you and the beak is towards patient's right. That means that's a right maxillary molar forceps. Understood? What you have to do is, how are you going to determine the side in your exam? Nothing. You don't need to panic. You just need to imagine. You need to create an imaginary clinic in front of you, that you are the operator and you have a patient in front of you. Now you have to imaginarily hold the instrument that is given in your picture in your hand and see on what side of the patient is this beak pointing towards, this particular beak. If you hold this particular instrument in your hand, this points towards patient's left, so this is a left maxillary molar forceps. Let's see the options here. It is a mandibular molar forceps, right side. No, it's definitely not a mandibular molar forceps. It is a maxillary molar forceps. It has no specific side determination. No, maxillary molar forceps will always have a side determination. It is a maxillary cow horn forceps, left side. No, cow horn forceps is different. It has a sharp one of the entire beak is sharp, and it is a maxillary molar forceps, right side. Yes, this is the correct answer. Okay, this is the correct answer. Now this is identify the instrument. So a sharp beak like this, sharp beak at 90-degree angle. This is your Crier's elevator. Okay, this is your Crier's elevator. Now this instrument, the beaks are similar to Crier's. Why I have put it one after the other is because you need to differentiate. The beaks are exactly similar like that of Crier's, but please note this long shank has a handle at 90 degrees. There's a handle at 90 degrees. Okay. Again, this is a paired instrument. Look at the positioning of the handle. We will quickly go back to our previous instrument. Here the handle is in the same axis. Here the handle is in the same axis. Okay. So this is your Winter's crossbar elevator. Winter crossbar elevator. Okay. Beaks are the same, just that the handles are different. Now just look at this small, slender, long instrument with a small curve, small gradual curve at the end. This is your Warwick-James elevator curved. Warwick-James elevator curved. Okay, there's a straighter variety also where this beak is, in spite of being curved, a flat beak like this. Alright, flat end or a flat working end. Rather than a beak, the better term would be a flat working end. Alright, so that is a straight Warwick-James elevator. This is Warwick-James elevator but curved. Okay. Now, this says identify the oxygen cylinder from the given images. So, if you see image 1, it has white shoulder, black body. Image 2 is a blue cylinder. Image 2 is a blue cylinder. And image 3 is a black cylinder. Okay, so I have a small table over here. It says identify the oxygen cylinder from the given images. Now let's see. Oxygen is black body with white shoulders. Nitrous oxide is blue and nitrogen is black. Nitrous oxide is blue, nitrogen is black, and oxygen is black body with white shoulders. Please remember, since we use nitrous oxide for conscious sedation in pediatric dentistry, you can be asked regarding nitrous oxide cylinder also. So just keep in mind this image and you'll be able to remember. So here it says to identify the oxygen cylinder from the given image. So answer is image 1. Answer is image 1. Okay. All these 3 cylinders are important to us. So please remember them. Now this says identify the given image. If you see this is a long thin tube, has some lock kind of a thing over here, okay, and this is its pointed end. So this is your Ryle's tube, or also known as a nasogastric tube. You insert this tube through the nose and this tube goes up right till the stomach. There are certain markings on this tube: 50 centimeters, 60 centimeters, and 70 centimeters. Alright, so these markings are to identify whether you have reached the gastric, whether you have reached the stomach or not. Alright, so this is the inlet. So this tip here, this tip is one that goes inside the stomach. This tip remains outside the patient. So this is a nasogastric tube. So this tip will, certain amount of the tube will be hanging out from the nose, and this end you can connect your feeding bag or you can give your feeds. This is the inlet for the, this is the inlet. Alright, this is the inlet. What is this? Ryle's tube. Please don't get confused. Or a nasogastric tube. अगर Ryle's tube नहीं दिया है options में, nasogastric tube दिया है, that is also the correct answer. This is also known as a nasogastric tube. Alright, so it is used for feeding the patient. Identify the image given. So the correct answer is option B, that is Ryle's tube. That is your Ryle's tube. Okay. Now the last image for today. This says identify the tube. Short, small tube. This is the cuff. Okay. ये cuff में हवा भरने का inlet. This one is the inlet through which you can inflate the cuff. Alright, and this has a pilot. This is a pilot. Okay, so this is your tracheostomy tube. A tracheostomy tube can be uncuffed also. Tracheostomy can be uncuffed. It will look somewhat like this. Uncuffed tracheostomy tube will look like this. Okay, so this is your tracheostomy tube. So a hole is created here in the trachea, and this tube is inserted in the trachea to establish an airway. This is one of the definitive airways, and this is used especially in patients where prolonged airway needs to be maintained. Don't worry, I will be covering this in my classes, this concept in detail. Don't worry about that. So this is a tracheostomy tube. It asks you to identify, this is your tracheostomy tube. Alright, so with that we will end this session, and in subsequent sessions we'll be taking more image based questions. So I hope all of you enjoyed the session, and you can go back and revise so that you understand better. If there are any doubts, you can always ask us. And thank you so much.